Good afternoon, everyone. Welcome to our live Q&A call. My name is Steve Porcaro, and with me today is Barry Rubin.
As always,
I,
hi.
I was going to say that, but if I say that and you're not there someday, then it's not, that's like the usual suspects. So I don't want to take you for granted. So, all right. So Barry's with us today. She'll be our co-host. And want to thank you for joining us. We're approaching these calls over the last few months. We've learned a lot from our audience. And one of the feedbacks we're getting is that we want to position this as a lunch and learn type Q&A call. So going forward, we're thinking of formatting this a slightly different with a lunch and learn format and thinking about having themes throughout the month to make it easier to allow people to come on. So I just want you to stay tuned as we roll this out. We're fine tuning the approach. We actually may send a survey out to everybody to get some feedback. So it's very exciting. So I just want to give you a heads up on that. Before we start, just want to take a moment, go over housekeeping. If for some reason we get disconnected, please dial right back in. On occasion, little glitch in the matrix, the system, we get disconnected, the line disconnected, and sometimes people get dropped. Nothing on our end usually, unless I lean on the keyboard. But for the most part, just call right back in. If you have to jump off, don't worry, we send out a recording to everybody. I'll send it back through LinkedIn. I'll send it through the email, and that way you can listen at another time, similar to a podcast. We're going to be taking all of these calls and converting them to a podcast, so you can take all of this information while you're on the road, or I like to do it on the treadmill, so to speak. Also, you can submit your questions in. Right now, if you look at the bottom of your screen, there should be a little toolbar or up in the corner, depending how you have this set up on your screen. You have a chat menu. Barry and I will be monitoring that through the call. There's a question and answer menu. You can type your question there. And then if you'd like to speak, just send us a note through the chat, and we can turn on your microphone to allow you to chat. The one thing I do ask, one is really, if you're in a noisy area and I turn your microphone on, just try to minimize the background noise. If you're driving and sometimes people are calling in on the phone, unfortunately, there's no way for me to know whether or not to turn your microphone on. If you have a question, my suggestion is pull over, send it through the chat, send it through the Q&A system, and we'll be able to answer your question. But I think other housekeeping tips, Barry, did I forget anything?
No, I think we're good. Yeah, how to chat, how to make sure you're muted if they're on the phone calling in. And yeah, that's it. We're
All
good.
right, good. So again, welcome to 2020. It takes a while to get used to that. I've been writing 2019 for the last few days, and eventually I'll get used to 2020. But as we start off the new year, one of the things that it comes up on a regular basis, everyone talks about resolutions, everyone talks about goal setting. One of the things we wanted to do was share some high level book summaries, some classic books that are out there that have been very helpful. And one of the things I wanted to do was talk about, anyone ever see this book, First Things First? So the funny part is I have 2 copies of this because I bought one copy, and then a few years later I said, man, I really got to get that book, First Things First. And I bought another copy, and then I'm putting it on my bookshelf, and I said, oh, I already have one. So I have a couple of DVDs like that and a couple books, things that I go back to, my go-to books. These are good reminders. There's a lot of information out there about setting yourself up for success going forward. And uh, Stephen Covey is always a good place to start. He's been out there for a long time. He's almost one of the original gurus, or at least from a foundation standpoint. The Habits of Highly Effective People was the predecessor to this book. And First Things First was really an offshoot of that book, because I think number one or two on the 7 Habits of Highly Effective People was doing the first things first. And the interesting thing is, when I'm working with clients, organizations, teams, individuals, we do a portion of our work together is figuring out what are the first things first we have to do. And sometimes we get caught up with what's going on, that we want to jump head first or feet first right into that fire. And a perfect example of that is, and Barry and I, again, we've talked about this over the years with many people in our LinkedIn groups and our meetings and calls, is that people will call and they'll say, hey, I'm transitioning and I need help with my resume. And I'll say, great. What about everything else? And they go, what do you mean? All I need is my resume. I said, well, time out. We need to backtrack a little bit and figure out who, what, when, where, why, and how before we even write that resume. So the interesting thing here is, when we talk about first things first, it's almost taking a moment to check your direction, your inner compass, your inner clock, and figure out what exactly am I trying to accomplish. And the tough part here is, and again, I don't want to give away the book. I just want to share a couple top level ideas. One of the things, and we all struggle with this with our technology supported society at the moment, right? Our cell phones, our smartphones. So in front of me, I have my computer with 2 monitors. I have a laptop to the left of me. I have a tablet to the right of me, and I have a smartphone. And the idea was, having all this technology to help us accomplish more tasks, thinking we're more efficient, doesn't make us more effective. And I think one of the things we struggle with is finding all these shortcuts to do things quicker, not necessarily better. And unfortunately, it's been this mantra that we've fallen into. And I think a perfect example of when we go counter intuitive is when we binge watch shows on Netflix or Hulu or Amazon Prime or wherever you're watching, because we'd like to watch the show, but I don't want to have time for commercials. I would rather say, hey, I'm going to take a few hours and catch up over the last month. So in some ways, we can be effective and efficient there, but sometimes we have to moderate that. And there is a lot of things we're doing that we're told we have to hurry up, we have to hurry up, we have to be first. But the funny part is, if we're not in alignment with where we want to go, and I hear this from clients, people feel like they're in this that hamster wheel where they're running fast and they're not getting ahead, or they're in this rotary waiting for something to happen. And it does happen with certain clients of mine who they're at this point with their life and their career and their job, and they're in this rotary saying, how do I reconcile this? I have all these tools and resources. Which way do I go? So this first things first concept, I think, is important to take the time to reevaluate where you're going, why you're going in that direction, what do you need to do first. And it applies to our personal life, our professional life, if you're doing professional development, your career, whether you're transitioning, and then more importantly, if you're trying to grow your business or start your business. There are so many things we can be doing, but at the end of the day, we have to be true to ourselves and be in alignment with who we are and what we can do. I think the fallacy out there, and again, maybe it's the technology with our smartphones, if I was only as smart as my smartphone, I'd be able to solve all the problems in the world, right? I don't think that's true, but it'd be nice to think that. So I just wanted to throw that out there as something to think about going forward. And Barry, do you have anything? Because I know we've talked about some of these things in the past. Anything that you've run into that you'd like to share as an example?
Um, Great question. I think for me, that one of the points that you mentioned that was key was um, before you can write your resume, you have to know who you're writing it for, because otherwise it just becomes a list of responsibilities and it's very task oriented and it doesn't really market you for your talents. It's just a checklist. And unless some generic company is looking for a box checker, it's not going to get you anywhere. So that introspection of figuring out who your target audience is and who you are so that you can paint yourself in the best picture specifically to entice your target audience, that's definitely a great starting point. And that same concept also works for attracting new customers. If you're a business owner and you want to grow your business, you have to understand who your target customer is and build your pipeline and all of your marketing materials accordingly so that you get the pipeline from your business effectively. So that's I think just knowing where to start is definitely the best the best advice, and that first things first thing.
Yeah, no. Well, and the funny thing is, and again, I run into this personally and professionally. Uh, we're moving so fast. We have so much momentum. One of the things that I'm trying to do better, constantly fine tuning, is taking time to plan my week, to plan my time, to plan my successes, to plan a process, a system. The one thing that I have done, knock on wood, I think pretty successfully over the last, I don't know, few years, is I've been taking more time to take care of me, because I've realized if I don't take time for self-care, physically, mentally, emotionally, ecumenically, spiritually, whatever you want to call it, I'm not going to be able to take care of my family, my customers, my friends, my scouts, anyone on my team that I'm leading, any of the community organizations I'm part of. So sometimes that first things first, we have to take care of ourselves. And yes, I am planning another backpacking trip. You know, we talk about this all the time. And, you know, when I'm teaching a course coming up for a scout training on backpacking and hammocking for people who are interested first time. And the interesting thing is, can you jump right in there and start? Sure, you can. But the reality is, like a lot of things in life, you want to plan it. If you were going on vacation, you'd take time to plan it. If you were getting married, you'd plan it. If you were having some type of special event, you'd plan it. If you were doing something in a business setting where you're having some type of meeting, you'd do planning, you'd take time. So I think taking a breath, taking a moment, you can check out first things first. And I may start a book group. We may have a book call, because we've been getting calls about this, and maybe having a discussion group on a different night or a different day to discuss this, because this is something that I don't remember being taught how to do any of these things. Military, school, my professional life, I don't know if we ever had training on that. Maybe somewhere along the line, I know my old managers talked about it, but I don't remember anyone ever doing that with me. So I'm using my smartphone. Barry is another person I use to help keep me on track. But at the end of the day, we have to take some time to do first things first for us. So with that being said, I want to open it up to some questions. Again, if you have a question and you want to email it in, if you can't be on the call, feel free to send that at info@salesplusmvp.com. And we do take some questions that get mailed into us. We try to answer them. We do have a few questions, but there are some people on the call that I'd like to take their questions. Nate, I'm going to go to you first. Would you like me to turn your microphone on? And if you're shaking your head, I can't see that. All right. All right, Nate, your microphone's on. Let me unmute you. All right, buddy, take it away.
Hey, how's it going, Steve?
Good.
How's it going, Barry?
Great, thanks.
Good. Hi, I'm glad that you guys are, putting this webinar on this Tuesday. It's really just enlightening to hear you talk about the book. I'm definitely gonna go check that out. I run a hardware tech company out of Southern Illinois, known as Spreck Technology Services LLC. We've been in business for a little over 2 years now, and you hit it right in the head. Take a step back and figure out what it is that you're trying to figure out and what it is that you're trying to do before you could even go forward with growing your business. And that's been me. I've been really introspective this last 60 days or so. So now I guess my question now is, I know it's not medical sales or anything healthcare related, but how would I make that transition from what I'm doing now, which is business to business sales, business to consumer sales, to medical device sales, or to healthcare device sales?
Okay, that's a good question, and I'll certainly share as much as we can, time allotted. The one thing I will tell you to do, Nate, and again, I know we just connected recently on LinkedIn, I actually put together almost like a cheat sheet of the step-by-step process that I use with people who are looking to break into medical device sales. It's called Recipe for Success. It's one of my LinkedIn articles, and we'll put a link to this in the recording, and I'll make a note to send that to you as well. But at the step one, and it's funny how it kind of goes hand in hand, is you have to step back and say, what type of sales professional am I? And what type of product or service is a good fit for me? And I've done another webinar very similar to this using sports professionals as a good analogy, right? If you think about professional athletes, there's a wide range of professional athletes. You can be a pro golfer, a pro bowler, you can play basketball, football, hockey, and the list can go on. They're all professional athletes, but they all play a different game with different skill sets. They may have some common attributes, but you're not going to take a baseball player and then give him grief because he can't play, the front line on an NBA team. Just not a good fit. So what happens is, if you're doing B2B sales, that's a good start, but you may want to think about it a little bit more. Very simply, are you a hunter? Are you a farmer? Or are you something in the middle of like a consultative sales professional, or anywhere along that spectrum? And once you figure out what type of sales professional you are, that would give you a direction to start networking and learning about companies and products that will allow you to do more of the things you're good at in that particular field. Because if you take medical device or healthcare off it, it's still sales. And what happens is, you want to take your sales background and align it with a similar sales background or sales process in the medical or healthcare related field. So, to give you a perfect example, if you're in our LinkedIn group, Medical Device Sales Professionals, and there's over 85,000 people in there, there's no way you could possibly network with everybody. But if you say, hey, I'm looking at doing outside sales, OR sales, procedure-specific sales, maybe in orthopedics, now you've come from a shotgun to a laser, and then you can start reaching out to people and asking them, and learning more, get their advice and counsel about what's a good fit for you. Now, the second part of this is, and again, you'll see on this list and this article, there are so many other considerations that you have to factor in. Do you want to be an employee? Do you need to be an independent contractor? How much income are you looking for? Do you have geography requirements? You know, there's a whole slew of things you need to go through to build a good profile for you. So there is a process, and when you start moving along, that article will kind of walk you through, and you can do 99% of this yourself. I do have a program, Barry and I were just talking about it, a couple times a year. We run a program to help and support people through that, but you can certainly do that yourself to start moving, transitioning. Because part of this is you don't know what you don't know about the industry and that particular specialty, and I don't know what you don't know. But from a transition perspective, start with what you're bringing to the table, and then take a look at where you want to be 12 months, 18 months down the road, and that would help give you some direction. Yeah. Okay. So Brian just wrote a good note, Brian, and I was gonna get to that point too. The one caveat, and this does come up on occasion, is I'll have people, and this happened many times. Hey, I want to break into the operating room because my friend from college or so and so said it was a great, job, and they love it. They're selling, X, Y, Z, and I'll ask them. And this one person wanted to be a spine rep. And I said, do you know what a spine rep does? And they said, no. I said, well, they're making sales presentations in the in the physician's office, but they're also doing technical support in the operating room. And he said, I have to go in the operating room? I said, well, it's almost like working in a carburetor. You may not see much, right, depending on where you're working, but there is some blood. And some people, if they're not open to that, it's not a good fit. The other thing is, and again, I don't know everybody on the call, but sometimes I have women who have young children that they're the primary caregiver, and they say, yeah, I want to go into OR sales or procedure sales. And the tough part is, they said, yeah, but I only want to work from 9 to 3. And I said, well, that's really hard because the OR starts at 7. I carried a pager for, 18 years, and we were on call 24/7. So this is why, Nate, when you start looking at all of these things, there's a lot of factors to figure out what's a good fit for you. And to summarize this, just because of time, there are people out there selling Band-Aids who are very happy and very successful. And then there are people who are selling MRI machines, very successful, very happy, and everything in between. So anything used in a hospital setting or a healthcare setting to provide patient care is considered, a class 1, 2, or 3 medical device. And you just have to figure out, and again, it's a process. And that's why I put that article together to gradually move you through without saying, hey, because it works for me, it's going to work for you.
Wow. Thank you for that amazing response right there. That's really enlightening. Appreciate it.
Thank you. And I was going to say, Barry, and Nate, you're welcome, because we've only been doing this for, 10 years. But Barry, anything you want to add before we take another question?
Just quickly, based on the 2 pieces of information that we got from Nate, you mentioned that you wanted to transition into medical device sales, but the medical field isn't just devices. I have a connection who is the chief technical officer for a company that uses hardware to do video conferencing with doctors. So with your technology background, there may be other things that will help you break into the medical field that aren't necessarily medical devices. So that's why that first step of first things first is so important, because like we discussed earlier, you want to make sure you're targeting the right people, the right business, the right angle of the industry. Those are all things that are going to propel you towards success. Because if you're barking up the wrong tree, you might be sitting on the ground for a while.
Yeah, great advice right there. Great
Yeah.
advice. Do you mind if I connect with you, Barry, on LinkedIn
Sure, no
before I
problem.
get off? That'd be
No
perfect.
problem.
Yep. All right, Nate, anything else before we go on to the next question?
Nope. You guys have a wonderful week. I'll be listening in the background.
Great. Thank you, Nate.
Yep.
All right. I'm going to mute him. I'm not going to shut him off or disconnect him. I'm just going to mute him. So we have a few more minutes. Other questions from the group? It's always a good question, and I know people are transitioning, either coming into the field or transitioning within the medical device field, and it's an interesting concept. Again, when Barry and I, when I started the group and I met Barry, there were a lot of people on LinkedIn because it was the place to be and it was a great social networking area. And then over time, it morphed into almost like a jobs board. I think LinkedIn almost does as much business as Monster and Indeed. I don't know. Does anyone ever hear of Monster.com anymore? Is that they still out there? So it's pretty funny how things happen like that. So the other thing is this is a moving target, and what's going to happen is, in part of that article, first things first is important, but the second part is there's no one size fits all. Everyone comes from a unique background, unique experiences, and it's really taking your story and your strengths and weaving this together so people can understand the value and help. You need to connect the dots for them, how you can hit the ground running and help them be successful. And sometimes it's really hard. And again, I'll just share a quick story. I got recruited. I worked in the OR for 5 years while I was in the military, and I had a great experience working in the operating room. I had a lot of technical experience. I got recruited to sell orthopedic trauma equipment, and it was a great job, and I loved it. But just because I did it well doesn't mean that's where I wanted to be. The company that recruited me said, hey, you'd be a perfect fit. And I was a good fit. But the funny part was when I had children, I realized that being on call 24/7 wasn't conducive to a normal family life. So I was fortunate enough to be able to transition over to sports medicine, which was more elective than doing orthopedic trauma. So it's funny how when your needs change from where you were 5 years ago to where you are today, you have to think about where will you be in 5 years from now? What kind of job or position, or do you want to be working in a company where your opportunity and experiences can grow while you're with that organization? And again, it's really hard sometimes because I didn't know. It's only looking back in retrospect that I made the connection and say, if I had a chance to do it over, what would I have done different? And part of it, and Nate brought up a good point, is I didn't really think about where I wanted to be other than I was running away from the job I had versus running towards that other job that I was heading to. All right, any other questions before? I have one more question that I'm going to answer before we wrap it up. Barry, you see any questions on your? All right, so I did get a question that I'd like to answer. This came in last week about professional development. If you go online, the nice thing about technology, we have access to all this information. And one of the things we do as professionals, whether you're running your business, as a solopreneur, a salespreneur, or you're part of a team, the professional development role was always pushed off to the side, right? For a long time, I let my organization, my company, take care of my professional development. I figured if they wanted me to know it, they would teach me or they would have a training on it. Well, the reality was that only worked to a certain part, right? Your company, if you're an outside salesperson, if you're an independent salesperson, if you're a sales consultant or professional running your business or your territory like a business, you have to stay sharp. You have to keep your skill set sharp. So professional development has always been a something that was always a sideline, but over the last few years, people are taking a more active interest in saying, how can I be a better communicator, a better leader, a better listener? How can I be a better team member? How can I sharpen my emotional intelligence? And what happens is there's a lot of information going out there saying, and it's no different. If you were a professional athlete, you'd be practicing and going to the gym on a regular basis to get in shape for the game. Well, what do you do if you're in sales and you're in business? How do you stay in shape? So part of it is you can go out there and make the same mistake day after day, or you can invest in yourself, because at the end of the day, you're the most effective tool you have in your bag. And professional development is really up to you. There are some organizations that are investing in their people, and then there are other organizations that don't. And I can tell you pros and cons and horror stories, and Barry and I have shared some of these, that sometimes you have to invest in yourself if the company is not willing to invest in you. So the question came up, how important is professional development to my long-term success in my career? And in a sense, the answer I gave this individual and why I'm sharing it here is, it only matters if you care about your career or your business. Just like a lot of things in life, you're going to get out of your career or business what you put into that. And I think professional development is part of that. All right, so I think that's it for the day. Barry, anything we need to, I don't know, I can't believe we've already been on the phone for 35 minutes.
It just a little bit of humor to something that you mentioned earlier, and speaking about the importance of professional development. You know, if your career is not going where you want it to, of course you have to invest in it. The definition of insanity is doing the same things over and over and expecting different results.
Yeah, no, thank you. Yeah, it's a funny one. I don't know, in some ways, social media, and again, Barry and I, we joke about this, whether it's LinkedIn, Instagram, Facebook, YouTube, Twitter, in some ways, or some ways, the information's out there. We're closer than ever, but we're also separated by so many things. And it's a false sense of security sometimes. So it's, I think we're still trying to feel our way around it going forward. So
working smarter and not harder is definitely something that people have learned to embrace. And I think that's a lot of where burnout comes from, because sometimes people just spin their wheels so hard. If you're not getting anywhere, of course you're going to burn out. And so professional development is one of those things that you can do for yourself that will teach you and encourage you to work smarter.
All right. All right. Well, thank you for that. And again, final note, work smarter, not harder. Right. Well, sometimes, yes, sometimes I feel like I'm working harder. I wish I could be smarter, but that's a work in progress. But I want to thank you all for joining us today. Have a great week. We'll see you next Tuesday. Wherever you are, have fun. Have a good week. I'll see you then.
Bye, everybody.
Bye-bye.